40, mother bear, learned pediatric surgery to operate on bear cubs and human babies. Everyone was amazed before moving into the story. Let us know where you're watching from, and don't forget to like and subscribe. The mist hung low that morning, so thick that Ethan Marshall could barely see 10 feet ahead as his truck rumbled along the narrow mountain road. He had been driving for hours, leaving behind the familiar chaos of the city veterinary hospital where he had spent the last 15 years of his life. His hands gripped the steering wheel tighter as he remembered the last surgery he had performed there, the one that had gone wrong, the one that had made him question everything he thought he knew about healing. The GPS on his dashboard flickered and lost signal again, but he didn't need it anymore because Lily Morgan's handwritten directions were clear enough, even if her messages had been anything but ordinary. She had written to him 3 times over the past month, each letter more insistent than the last, claiming she had witnessed something in these woods that would change how he understood animals forever. At first, he had dismissed her as another rural eccentric with too much time and imagination, but something in her final letter had struck him differently. She had included photographs, blurry and taken from a distance, but showing enough to make his scientific mind curious despite his skepticism. The village appeared suddenly through the mist, a collection of wooden houses that seemed to grow from the mountain itself, their foundations carved from the same gray stone that jutted from the earth everywhere he looked. Ethan parked his truck near what appeared to be the only store in town, a small building with a hand-painted sign that simply read, "Supplies." The air here was different from anything he had experienced before, carrying a weight that pressed against his lungs with each breath, filled with the scent of pine needles and something else he couldn't quite identify, something ancient and wild. He checked his phone but found no signal, which didn't surprise him given how remote this place was. The silence was almost oppressive after years of city noise, broken only by the distant call of a bird he didn't recognize, and a strange, rhythmic clicking sound that seemed to echo from somewhere deep in the forest. That sound made him pause, because it didn't match any natural forest noise he knew, too regular, too deliberate, like someone tapping stones together in a pattern. Lily Morgan was nothing like what Ethan had expected from her letters. She was younger, perhaps in her early 30s, with eyes that held a sharpness that suggested she missed very little of what happened in these woods. She met him at the store, dressed in worn hiking boots and clothes that had clearly seen many trips through the underbrush. Her handshake was firm, her smile genuine, but tinged with something that looked like relief. She had been waiting for someone to take her seriously, he realized. Someone with the credentials to validate what she had been observing for months. They walked together through the village, past houses where curtains twitched, as curious residents watched the stranger who had come to their isolated community. Lily explained that she had been a wildlife photographer before moving here 5 years ago, seeking solitude and a chance to document the untouched wilderness. What she had found instead was something that had consumed her every waking moment since she first witnessed it 6 months ago. The path into the forest was barely visible, marked only by subtle signs that Lily pointed out as they walked. A broken branch here, a displaced stone there, markers she had left for herself during her many trips to the clearing. The trees grew denser as they climbed, their branches intertwining overhead to create a canopy so thick that even the persistent mist couldn't penetrate fully. Ethan found himself having to concentrate on each step, the uneven ground threatening to trip him with roots and rocks hidden beneath a carpet of decomposing leaves. Lily moved with practiced ease, occasionally glancing back to make sure he was keeping up, her expression patient but eager. She had tried to bring others here before, she explained as they walked, but most had given up before reaching the clearing, dismissing her claims without seeing the evidence for themselves. The local doctor had come once, but had left convinced she was mistaken, that what she had seen was simply normal animal behavior misinterpreted by an overactive imagination. They had been walking for nearly an hour when Lily suddenly stopped and held up her hand for silence. The clicking sound Ethan had heard earlier was louder now, coming from somewhere ahead of them, accompanied by other sounds that made his skin prickle with an inexplicable anticipation. There was a low humming, almost like a lullaby, and the soft rustling of something moving with deliberate care through the underbrush. Lily motioned for him to crouch behind a large boulder, its surface covered in moss so thick it muffled any sound they might make. She pointed through a gap in the trees, and Ethan had to blink several times to process what he was seeing. In a small clearing, perhaps 30 feet away, a massive brown bear sat with her back partially turned to them. But it wasn't her size that made Ethan's breath catch in his throat, it was what she was doing. The bear held her cub with a gentleness that seemed impossible for such powerful limbs, one massive paw cradling the small body, while the other worked with a precision that defied everything Ethan knew about animal behavior. She held what appeared to be a sharp piece of flint, its edge clearly shaped by repeated use rather than natural breaking. The cub had a gash along its side, probably from a fall or encounter with another animal, and the mother bear was cleaning the wound with movements so careful, so deliberate, that Ethan found himself leaning forward despite Lily's warning hand on his arm. The bear would pause periodically, examining her work, then resume with the same focused intensity he had seen in surgeons during his training. She made soft sounds to her cub, not the typical grunts and huffs of bear communication, but something more melodic, almost like she was explaining what she was doing, keeping the young one calm through the procedure. What happened next challenged every scientific principle Ethan had built his career upon. The bear set down the flint and reached for something she had placed on a flat rock beside her, a collection of different mosses and what looked like tree sap. She selected specific pieces with the same deliberation a pharmacist might show when preparing medication, combining them in a way that suggested not random instinct, but learned knowledge. She applied this mixture to the wound with incredible care, using a smooth stick to spread it evenly, ensuring complete coverage without causing additional pain to her cub. The young bear remained remarkably still throughout, occasionally making small sounds that its mother would respond to with those same melodic tones, adjusting her touch when the cub showed discomfort. Ethan's mind raced as he watched, trying to reconcile what his eyes were seeing with what his education told him was possible. Bears were intelligent animals, certainly, capable of using basic tools and showing complex social behaviors, but this level of medical understanding, this deliberate surgical intervention, was supposed to be uniquely human. Yet here was evidence that challenged that assumption so fundamentally that he felt the foundations of his understanding shifting beneath him like the uncertain ground of the forest floor. He glanced at Lily, who was watching his reaction with a mixture of vindication and sympathy. She understood the cognitive dissonance he was experiencing because she had gone through it herself months ago when she first witnessed this impossible scene. The procedure continued for another 20 minutes, the bear mother working with unhurried precision, occasionally stopping to observe her cub's breathing, checking for signs of distress with an attentiveness that spoke of experience and understanding. When she finally finished, she gathered her cub against her chest, that massive body becoming a fortress of warmth and protection. The cub nuzzled into her fur, making contented sounds that needed no translation. The mother bear then did something that made Ethan's hands tremble as he tried to hold his phone steady to record what he was seeing. She carefully cleaned her tools, the flint and the stick, wiping them on grass and then wrapping them in large leaves before placing them in a hollow at the base of a nearby tree. Clearly, a storage place she returned to regularly. As they watched, other movement in the clearing caught Ethan's attention. A fox emerged from the underbrush, limping noticeably, its left front paw held at an awkward angle. Instead of fleeing at the sight of the bear, the fox approached slowly, making soft whimpering sounds. The bear turned to look at the smaller animal, and Ethan could have sworn he saw something like recognition in her eyes. She made a low rumbling sound, not threatening but almost welcoming, and the fox came closer, eventually lying down near the bear with a trust that defied every predator-prey relationship Ethan had studied. The bear examined the fox's injured paw with the same careful attention she had shown her cub, her massive head lowering to sniff and inspect the injury from different angles. Lily leaned close to Ethan's ear, her whisper barely audible even at that distance. She explained that she'd been documenting these interactions for months, that the bear seemed to have established some kind of medical practice here in the forest, treating not just her own cubs, but other animals as well. The fox was a regular patient, having first appeared 2 months ago with a different injury that the bear had treated successfully. Since then, other animals had come, some repeatedly, seeking help for various ailments and injuries. It was as if word had spread through the forest that this bear possessed healing knowledge, and the animals had overcome their natural fear to seek her aid. The implications of what Ethan was witnessing began to sink in as he watched the bear gently manipulate the fox's injured paw, feeling along the bones with a touch so light it seemed impossible from such massive paws. She was checking for breaks, he realized, performing the same examination he would do in his clinic, looking for swelling, testing range of motion, assessing the extent of the damage. The fox remained still, occasionally making soft sounds that the bear would acknowledge with her own vocalizations, a communication that transcended species in a way that made Ethan question everything he thought he knew about animal consciousness and intelligence. The bear reached for her tools again, selecting different materials this time, crushing certain leaves between her paws to release their oils before applying them to the fox's injury. She worked with the same methodical precision she had shown with her cub, but adjusted for the different anatomy, the different needs of her patient. It was this adaptation, this ability to modify her technique based on the specific requirements of each case, that truly astounded Ethan. This wasn't instinct or mimicry. This was understanding, knowledge applied with wisdom and care that suggested a level of cognitive function that science had never documented in any non-human species. As the afternoon light began to fade, filtered through the canopy in long, golden streams that made the mist glow like something from a fairy tale, the bear completed her treatment of the fox. The smaller animal tested its paw gingerly, then with more confidence before making a sound that Ethan could only interpret as gratitude. It touched its nose to the bear's massive paw, in what looked remarkably like a gesture of thanks before disappearing back into the underbrush, its gait already noticeably improved. The bear watched it go, then turned her attention back to her cub, grooming it with long strokes of her tongue, a normal maternal behavior that seemed almost mundane after what they had just witnessed. Ethan realized his legs had gone numb from crouching in the same position for so long, but he didn't dare move, afraid that any sound might disturb this remarkable scene. His mind was already racing with questions, theories, and the overwhelming need to document everything he was seeing. This discovery, if he could verify it, if he could study it properly, would revolutionize our understanding of animal intelligence and capability. But even as the scientist in him planned research protocols and peer review processes, another part of him, a part that had been dormant since he became disillusioned with his work, felt something else entirely. He felt wonder, pure and simple, the kind of awe that had first drawn him to veterinary medicine before years of routine and failure had worn it away. Lily touched his arm again, indicating they should leave before the bear noticed them. They backed away slowly, carefully, retracing their steps with even more caution than they had used approaching. Neither spoke until they were well away from the clearing, the sounds of the forest returning to normal around them, birds calling, and small animals rustling through the underbrush as evening approached. When Lily finally did speak, her voice was filled with the same wonder Ethan felt, telling him that what he had seen today was just the beginning, that there was so much more to show him, so much more that would challenge everything they thought they knew about the natural world. They made their way back to the village as darkness began to fall, the mist growing thicker until it seemed like they were walking through clouds. Ethan's mind was spinning with what he had witnessed, trying to process the implications while simultaneously planning how to properly document and study this phenomenon. He would need equipment, cameras with night vision capabilities, recording devices that could capture the subtle vocalizations, and most importantly, he would need time to observe without interfering. The ethical implications were staggering as well, because if this bear truly possessed this level of intelligence and medical knowledge, what right did they have to study her like a laboratory specimen? These were questions that would need careful consideration, but for now, the priority was to document what was happening here before skeptics could dismiss it as fantasy. That night, Ethan sat in the small room Lily had arranged for him above the village store, his laptop open as he tried to transcribe everything he had seen while it was still fresh in his memory. But words seemed inadequate to capture the profound nature of what he had witnessed. How could he describe the deliberate way the bear had selected her medicinal plants, the gentle precision of her surgical technique, the obvious communication between her and her patients? How could he make others understand that this wasn't anthropomorphism or wishful thinking, but observable, documentable behavior that suggested a level of consciousness and capability that science had never imagined possible in a non-human animal? He wrote, late into the night, the clicking of his keyboard the only sound in the silent village, while outside the mist pressed against his window like something alive, hiding secrets that were only beginning to reveal themselves. The next morning brought clearer weather, the mist lifting enough to reveal the stunning beauty of the mountain landscape that surrounded the village. Ethan met Lily at first light, both of them eager to return to the clearing, to continue their observations. Lily brought better recording equipment this time, cameras she had been saving to purchase, finally having someone who could help her prove that what she had been seeing was real. They took a different route this time, Lily explaining that she had mapped several approaches to avoid creating a worn path that might alert others to the location. The bear's clearing needed to remain secret, at least until they better understood what they were dealing with, until they could ensure that any research would be conducted ethically and with respect for this remarkable creature. The forest seemed different in the morning light, less mysterious but no less magnificent. Ancient trees towered above them, their trunks so massive that it would take several people holding hands to encircle them. The forest floor was carpeted with ferns that reached Ethan's waist, their fronds still wet with dew that soaked through his pants as they walked. Every few steps revealed something new, a cluster of mushrooms growing in impossible spirals, a spider's web so perfect it looked like art, a stream so clear he could count the pebbles at its bottom. This was a world untouched by modern civilization, a place where nature still held secrets that humans had forgotten existed. They reached an observation point Lily had established weeks earlier, a natural blind created by fallen trees and thick brush that provided cover while offering a clear view of the clearing. She had been smart about it, choosing a position downwind from where the bear usually worked, ensuring their scent wouldn't carry and alert her to their presence. They settled in to wait, Lily setting up her cameras with practiced efficiency while Ethan prepared his own equipment, a combination of scientific instruments and recording devices that would help him document what they observed with academic rigor. The waiting was the hardest part, sitting in silence while the forest went about its business around them, every small sound making them tense with anticipation. Ethan found himself thinking about his life back in the city, the sterile environment of the veterinary hospital, the endless stream of routine procedures, the growing sense that he was just going through the motions rather than making a real difference. He had become a veterinarian because he loved animals, wanted to help them, but somewhere along the way, it had become just a job. Another day of vaccinations and spay procedures and putting down pets whose owners couldn't afford treatment. Here, watching this bear practice medicine with a purpose and skill that transcended anything he had imagined, he felt that old passion rekindling. It was nearly noon when the bear appeared, moving through the forest with a grace that belied her massive size. She carried something in her mouth, what looked like a bundle of plants wrapped in bark, and Ethan realized she had been gathering supplies. This wasn't random foraging but purposeful collection, selecting specific plants for their medicinal properties. She moved to her storage hollow and carefully added the new materials to her collection, organizing them in a way that suggested categorization, different plants for different purposes. The level of planning and organization this demonstrated was extraordinary, suggesting not just intelligence but foresight, the ability to prepare for future needs rather than simply reacting to immediate situations. A new patient arrived shortly after, a rabbit with what appeared to be an infected wound on its hind leg. The rabbit's approach was cautious but determined, and Ethan noticed it was making specific sounds, almost like it was announcing itself, asking for permission to enter the bear's space. The bear responded with her own vocalizations, and the rabbit came forward, lying on its side to present its injury for examination. What followed was another demonstration of the bear's remarkable abilities, but this time Ethan was able to observe with a more clinical eye, noting specific techniques. The way she cleaned the wound first with water from a hollow stone she kept filled, then applied what appeared to be an antiseptic mixture before the actual treatment began. The bear's knowledge of infection was particularly striking. She clearly understood the concept of contamination, carefully cleaning her tools between uses, avoiding cross-contamination between the infected wound and her medicinal supplies. This wasn't behavior that could be explained by instinct alone. This was learned knowledge, possibly passed down through generations or developed through observation and experimentation. The implications were staggering, suggesting that bears, or at least this bear, possessed a form of medical culture, a body of knowledge that was preserved and transmitted outside of genetic programming. As the afternoon wore on, Ethan and Lily documented 3 more treatments, each one providing new insights into the bear's capabilities. A young deer with a deep gash on its shoulder received stitches of a sort, the bear using thin plant fibers to close the wound with a technique that, while crude by human standards, was remarkably effective. A badger with what appeared to be a dislocated joint was treated with manipulation techniques that showed understanding of anatomy and biomechanics. Most remarkably, an old crow with a clearly broken wing was treated with what could only be described as a splint, the bear using straight twigs and plant fibers to immobilize the injury while it healed. Each patient showed the same pattern of behavior, approaching with specific vocalizations, waiting for permission, remaining still during treatment, and offering some form of acknowledgement afterward. It was as if the bear had established a medical practice in the truest sense, with protocols and expectations that both she and her patients understood. The communication between species was perhaps the most remarkable aspect, a complex system of sounds and gestures that transcended the normal boundaries of animal interaction. Ethan found himself wondering if this was unique to this bear, or if there were others like her, other animals who had developed capabilities that humans had simply never noticed or acknowledged. As the sun began to set, casting long shadows through the clearing, the bear completed her last treatment of the day. She sat back on her haunches, looking tired but satisfied, much like Ethan felt after a particularly challenging but successful day at the clinic. Her cub emerged from where it had been playing nearby, and she gathered it close, grooming it while making those soft, melodic sounds that seemed so unlike typical bear vocalizations. There was something deeply maternal about the scene, but also something more, a sense of purpose and fulfillment that transcended simple animal behavior. Lily and Ethan packed up their equipment carefully, both of them understanding that what they had documented today would need to be handled with extreme care. This wasn't just a scientific discovery, it was a revelation that could fundamentally change how humans viewed their relationship with the natural world. If animals were capable of this level of intelligence, of medical knowledge and interspecies communication, what did that mean for how we treated them, how we understood our place in the ecosystem? These were questions that would need careful consideration, but first they needed more evidence, more documentation, more understanding of what they were truly witnessing. The walk back to the village was quiet, both of them lost in their own thoughts. The mist had returned with evening, wrapping around the trees like a living thing, muffling sounds and creating an atmosphere of unreality that seemed appropriate given what they had experienced. Ethan found himself thinking about the bear's eyes, the intelligence he had seen there, the careful consideration she gave to each patient. This wasn't the blind instinct of an animal following genetic programming. This was conscious thought, decision-making based on observation and experience. It was everything science said animals weren't capable of, yet the evidence was undeniable. That night, Ethan couldn't sleep. He sat at his window, looking out at the mist-shrouded forest, knowing that somewhere out there a bear was possibly tending to injured animals with a skill and compassion that challenged everything humans believed about the natural world. He thought about the implications for conservation, for animal rights, for our entire understanding of consciousness and intelligence. If this bear could learn and practice medicine, what other capabilities did animals possess that we had simply never recognized? What other secrets were hidden in forests and oceans and skies around the world, waiting to be discovered by those willing to look with open minds and careful observation? The questions multiplied in his mind as the night wore on. How had the bear learned these techniques? Was it passed down from her mother, or had she developed them through her own experimentation? How did the other animals know to come to her for help? Was there some form of communication network in the forest that humans had never detected? And perhaps, most importantly, what was the limit of her capabilities? Could she learn new techniques if exposed to them? Could there be communication, real exchange of knowledge between her and humans if approached correctly? The possibilities were both exciting and terrifying, opening doors to understanding that humanity might not be prepared to walk through. Ethan pulled out his laptop and began writing again. This time, not just documenting what he had seen, but exploring the implications, the questions that needed to be asked, the research that needed to be done. He wrote about the ethical considerations of studying such a creature, the need to protect her and her habitat from those who might exploit or harm her. He wrote about the potential for learning, not just about animal intelligence, but about medicine itself, about traditional healing practices that might have been developed and refined by animals over millennia. And he wrote about the wonder of it all, the pure joy of discovering that the world was far more magical and mysterious than modern science had led us to believe. By dawn, Ethan had filled dozens of pages with observations, theories, and questions. he had also made a decision. He would stay here, in this remote village, for as long as it took to properly document and understand what was happening in that clearing. He would need to contact colleagues, carefully chosen ones who would approach this discovery with the respect and caution it deserved. They would need funding, equipment, and most importantly, a commitment to studying the bear without disturbing her work or revealing her location to those who might not have her best interests at heart. This was more than a research project now. It was responsibility to protect and understand something unprecedented in the history of human-animal interaction. The surgeon of the forest. The weeks that followed Ethan's first observation of the bear transformed his understanding of what they were witnessing. He had extended his stay indefinitely, setting up a makeshift research station in a cabin at the edge of the village that Lily had helped him rent from an elderly couple who asked few questions. The cabin was basic but sufficient, with enough space for his growing collection of equipment and the endless notes he compiled each day. Every morning before dawn, he and Lily would make their way to one of several observation posts they had established around the bear's territory, each offering different vantage points and allowing them to track her movements without intrusion. What became clear through their extended observation was that the bear's medical practice followed a remarkably consistent schedule. She would spend early mornings gathering medicinal plants, displaying an encyclopedic knowledge of the forest's pharmacopoeia that would put many human herbalists to shame. She knew exactly where to find specific plants at different times of the year, how to harvest them without damaging the source, and how to preserve them for future use. Ethan documented at least 40 different plant species she collected, each serving a specific purpose in her treatments. Some were clearly antiseptic, others appeared to reduce inflammation, and still others seemed to have analgesic properties based on how her patients responded after their application. The storage system she had developed was particularly fascinating. Beyond the simple hollow in the tree that Ethan had first observed, she maintained several caches throughout her territory, each protected from weather and organized with a logic that became apparent through repeated observation. Fresh materials were kept separate from dried ones. Toxic plants that she used in small doses were stored away from those used more liberally, and she had even created a primitive irrigation system using hollow logs to keep certain mosses moist and viable. The level of planning and organization this represented suggested not just intelligence but abstract thinking, the ability to conceptualize future needs and prepare for them systematically. Her surgical tools were another revelation. Through careful observation with telephoto lenses, Ethan and Lily documented a collection of at least 12 different implements, each serving a specific purpose. There were sharp flints of various sizes for cutting, smooth stones for grinding medicinal preparations, pointed sticks hardened by fire for precision work, and even what appeared to be needles made from thorns for the finest procedures. She maintained these tools carefully, cleaning them after each use and periodically sharpening or replacing them. Most remarkably, she seemed to be teaching her cubs not just how to use these tools, but how to make them, demonstrating the knapping technique for creating sharp edges from flint, a skill that anthropologists had long considered uniquely human. The range of conditions she treated expanded beyond what Ethan had initially observed. Over the course of 3 weeks, they documented treatments for infections, broken bones, deep lacerations, joint dislocations, eye injuries, parasitic infestations, and even what appeared to be a form of dental work on an old wolf with an abscessed tooth. Each condition required different techniques, different medicinal preparations, and different approaches to patient management. The bear adjusted her methods based on the species, age, and temperament of each patient, showing a sophisticated understanding of individual variation that went beyond simple pattern recognition. One particularly memorable case involved a pregnant doe who arrived at the clearing in obvious distress. The bear's examination was thorough but gentle, and she seemed to recognize that the deer was having complications with her pregnancy. What followed was perhaps the most remarkable demonstration of medical knowledge Ethan had yet witnessed. The bear prepared a specific mixture of plants that, when Ethan later researched their properties, were known to have oxytocic effects, stimulating uterine contractions. She fed this mixture to the doe and then stayed with her for hours, providing what could only be described as prenatal support, helping position the fawn for delivery when the time came. The successful delivery of a healthy fawn under the bear's care challenged every assumption about animal midwifery and suggested an understanding of reproductive biology that was simply unprecedented. The communication system between the bear and her patients became clearer with extended observation. It wasn't random vocalizations, but a structured form of interaction with consistent patterns. There were specific sounds for greeting, for requesting permission to approach, for indicating pain levels, and for expressing gratitude. The bear had different vocalizations for different situations, soothing tones for frightened patients, firm commands for those who needed to remain still, and what seemed like explanatory sounds when performing particularly complex procedures. Even more remarkably, many of her patients seemed to understand and respond appropriately, suggesting this communication system had developed over time through repeated interactions. Ethan began to notice that some animals returned not as patients, but as observers, watching the bear work on others of their species. A young fox that had been successfully treated for a leg injury weeks earlier would sometimes appear at the edge of the clearing, watching intently as the bear treated other foxes. It was as if these recovered patients were learning, possibly to help their own offspring or pack members in the future. This suggested not just individual healing, but the potential transmission of medical knowledge across species, a concept so revolutionary that Ethan struggled to find precedent for it in any scientific literature. The bear's diagnostic abilities were particularly impressive. She would often identify problems that weren't immediately visible, feeling for internal injuries, checking lymph nodes, examining eyes and ears with careful attention. In one instance, she refused to treat a superficial wound on a badger, instead focusing on its abdomen, repeatedly pressing gently in different areas until the badger vomited up what appeared to be a poisonous plant it had consumed. Only after dealing with the poisoning did she address the external wound, showing an understanding of treatment priority that many first-year medical students would struggle to demonstrate. Her understanding of dosage was another remarkable aspect of her practice. She adjusted the amount of medicinal preparations based on the size and species of her patients, using more for larger animals and less for smaller ones, but also accounting for other factors. Young animals received different preparations than adults, and she seemed to recognize that some species had different sensitivities to certain plants. This wasn't trial and error, but confident application of knowledge, suggesting either extensive experience or inherited understanding passed down through generations of medically capable bears. The social dynamics of the clearing began to reveal themselves as well. There was an unspoken protocol that all animals followed, a respect for the bear's space and work that transcended normal predator-prey relationships. Predators and prey would sometimes be present simultaneously, maintaining an uneasy but consistent truce while in the bear's presence. It was as if the clearing had been designated neutral ground, a place where the normal rules of the forest were suspended in favor of healing. Ethan observed a wolf waiting patiently while the bear treated a rabbit, the two animals studiously ignoring each other, despite being natural enemies just yards apart. The bear's cubs were increasingly involved in the practice as they grew older. Initially, they would simply observe from a safe distance, but gradually their mother began including them in simpler procedures. She would have them hold supplies, fetch water, or comfort smaller patients while she worked. It was clearly education, a deliberate passing on of knowledge that suggested this medical capability wasn't an isolated anomaly, but something that could be taught and learned. The implications for the evolution of animal intelligence were staggering, suggesting that complex knowledge could be transmitted culturally among animals just as it was among humans. One afternoon, Ethan observed something that made him reconsider the entire phenomenon from a new perspective. The bear was treating a crow with a damaged wing when she suddenly stopped, tilting her head as if listening to something neither Ethan nor Lily could hear. She made a series of vocalizations to her cubs, who immediately began gathering specific plants from her stores. Within minutes, another bear appeared at the edge of the clearing, limping heavily with what appeared to be a severe injury to its hind leg. This wasn't one of her cubs, but an adult male, typically solitary and territorial. Yet he approached with the same deferential behavior as the other patients, waiting for permission before entering the clearing. The treatment of this other bear was the most complex procedure Ethan had yet witnessed. The wound was old and infected, requiring extensive cleaning and debridement. The bear worked for over 2 hours, carefully removing dead tissue, applying various medicinal preparations, and even creating what appeared to be a drainage system using hollow reeds. Throughout the procedure, the male bear remained remarkably still, occasionally grunting but never showing aggression despite what must have been considerable pain. When the treatment was complete, the male bear did something extraordinary. He brought forward a large salmon he had been carrying, placing it before the female bear in what could only be interpreted as payment or gratitude for her services. This exchange suggested an economy of sorts, a system of reciprocal benefit that went beyond simple altruism. Ethan began to notice other instances of this, patients bringing offerings of food, useful materials, or even medicinal plants the bear hadn't collected herself. It wasn't required, as she treated many animals who brought nothing, but those who could contribute seemed to do so willingly. This added another layer of complexity to the phenomenon, suggesting not just medical practice, but a form of social contract, an understanding of mutual benefit that required abstract thinking and future planning. The bear's knowledge wasn't static but appeared to be evolving. Ethan observed her experimenting with new combinations of medicinal plants, testing them first on minor injuries to assess their effectiveness. When something worked particularly well, she would incorporate it into her regular practice. When something didn't work or caused adverse reactions, she would discontinue its use. This scientific method, this process of hypothesis, experimentation, and refinement, was exactly how human medicine had developed over millennia. To see it occurring in a bear challenged the very foundations of what separated human intelligence from animal cognition. Weather patterns seemed to influence both the types of injuries the bear treated and her approach to treatment. During a particularly severe storm that lasted 3 days, she had prepared in advance, gathering extra supplies and creating sheltered areas where injured animals could recover, protected from the elements. She seemed to understand that certain weather conditions led to specific types of injuries, falls during high winds, hypothermia during cold snaps, infections during particularly humid periods. This meteorological awareness added another dimension to her medical practice, showing an integration of various types of knowledge that suggested highly sophisticated cognitive processing. The bear's influence extended beyond direct medical treatment. Ethan began to notice changes in the behavior of animals throughout the forest, not just in the immediate vicinity of the clearing. There seemed to be less aggression overall, fewer territorial disputes that resulted in serious injury. It was as if the availability of medical care had changed the risk-benefit calculation of aggressive behavior. Why fight to the death when injuries could be treated? This subtle shift in the forest's social dynamics suggested that the bear's practice was having ecosystem-wide effects, potentially altering evolutionary pressures and survival strategies. One of the most touching observations came when the bear treated an elderly rabbit that was clearly nearing the end of its life. The rabbit's condition was beyond her ability to cure, but she provided what could only be described as palliative care, making the animal comfortable, providing pain relief, and staying with it until it passed. She then did something that brought tears to Lily's eyes. She covered the body with leaves and flowers in what appeared to be a burial ritual, her cubs watching solemnly as she completed this final act of care. The recognition of death, the provision of comfort care, and the ritualistic treatment of the deceased suggested a level of emotional and spiritual development that science had never documented in bears. The technological aspects of the bear's practice continued to evolve as well. She had begun creating more sophisticated tools, including what appeared to be a primitive mortar and pestle for grinding medicinal preparations more finely. She had also developed a way to create sterile water by filtering it through sand and charcoal, a technique that showed understanding of contamination and purification that wouldn't have been out of place in early human settlements. Each innovation was carefully tested and refined, then incorporated into her regular practice if it proved beneficial. Ethan's documentation of the bear's pharmacopoeia revealed another remarkable aspect of her knowledge. She didn't just use plants medicinally but understood their interactions. Certain plants were never used together, while others were always combined for synergistic effects. She had antidotes for toxic plants that some animals accidentally consumed, and she seemed to understand concepts like therapeutic windows, the difference between medicinal and toxic doses. This sophisticated understanding of pharmacology suggested either an incredibly long tradition of accumulated knowledge or cognitive capabilities that allowed for complex, abstract reasoning about cause and effect. The seasonal variations in the bear's practice were also noteworthy. As autumn progressed toward winter, she began preparing for hibernation, but not in the typical way. She trained her older cubs more intensively, ensuring they could handle basic treatments in her absence. She prepared detailed caches of preserved medicinal materials that would remain viable through the winter months. Most remarkably, she seemed to be teaching certain regular patients, particularly the more intelligent species like foxes and crows, how to perform basic wound care on themselves and their kin. It was as if she was ensuring continuity of care even during her dormant period, a level of forward planning that required understanding not just of immediate needs, but of future circumstances and the needs of others. The communication network that alerted animals to the bear's services became more apparent through extended observation. Crows and ravens seemed to play a particularly important role, their calls changing when they spotted an injured animal, almost like an emergency broadcast system. The bear would often respond to these calls, sometimes traveling considerable distances to reach animals too injured to make it to the clearing. This mobile medical service added another layer of sophistication to her practice, suggesting not just a fixed location for treatment, but an understanding that some patients required immediate on-site care. Ethan began to wonder about the origins of this remarkable ability. Was this bear unique, a singular genius among her species, or were there others like her? The way her cubs were learning suggested this knowledge could be passed on. But was it a recent development or an ancient tradition that humans had simply never noticed? The questions multiplied with each observation, each new behavior adding layers of complexity to the mystery. He had begun corresponding carefully with select colleagues, sharing limited information to gauge their reactions and identify those who might be trusted with the full scope of the discovery. The ethical implications weighed heavily on both Ethan and Lily as their documentation grew more comprehensive. They had enough evidence now to publish, to share this discovery with the world, But what would be the consequences? Would the bear be captured for study? Would her habitat be overrun with researchers and tourists? Would the delicate balance she had created in the forest be destroyed by human interference? These questions kept Ethan awake at night, knowing that they held responsibility not just for scientific accuracy, but for the welfare of this remarkable creature and the ecosystem she had influenced. As winter approached and the bear's activity began to slow in preparation for hibernation, Ethan made a decision. He would continue his observations through the winter, documenting how the forest adapted to the bear's absence, how her trained cubs and patients managed without her. He would use this time to carefully prepare his findings, to build a network of ethical researchers and conservationists who could help protect the bear while studying her. This discovery was too important to rush, too precious to risk through premature or careless revelation. The last day before the bear entered hibernation was particularly poignant. She made rounds to all her storage sites, checking supplies and making final preparations. She spent extra time with each of her cubs, reinforcing lessons and 似乎在通过虹膜和声音传递最后的指导. Several of her regular patients came to the clearing, not for treatment but what seemed like farewell visits. The old wolf she had treated months earlier sat at the edge of the clearing for hours, as if standing guard. The fox family she had helped brought her a rabbit, leaving it at the entrance to her den. Even the crows gathered in unusual numbers, their calls different from their usual raucous noise, almost melodic. As the bear finally retreated to her den with her youngest cubs, the forest seemed to hold its breath. Ethan and Lily packed up their equipment for the last time that season, both of them feeling they had witnessed something profound, something that transcended scientific discovery and touched on the fundamental mysteries of consciousness, intelligence, and the interconnectedness of all living things. They walked back to the village in contemplative silence, knowing that their lives had been forever changed by the surgeon of the forest, the bear who had shown them that the boundaries between human and animal intelligence were far more fluid than anyone had ever imagined. The winter months would bring new challenges and new questions. How would the forest cope without its healer? Would the cubs successfully carry on their mother's work? Would the network of communication and cooperation she had established survive her absence? These questions would drive Ethan's research through the cold months ahead. But for now, as the first snow began to fall and the forest settled into its winter quiet, he felt privileged to have witnessed something that challenged everything he thought he knew about the natural world. The bear had shown him that intelligence, compassion, and medical knowledge were not uniquely human traits, but part of a larger tapestry of consciousness that connected all living things in ways science was only beginning to understand. The winter had passed with an unusual quietness that settled over the village like a heavy blanket, and spring arrived with a burst of life that seemed to awaken not just the forest, but something primal in everyone who lived near it. Ethan had spent the cold months analyzing his data, corresponding with carefully selected colleagues, and preparing for the bear's emergence from hibernation. But on this particular morning in early April, the excitement of the bear's expected return was overshadowed by a crisis that would test everything he had learned about the remarkable creature and her influence on the forest community. Jacob Bennett was 7 years old, with the kind of boundless energy that kept his parents, Michael and Sarah Bennett, in a constant state of vigilant exhaustion. He had his mother's curious nature and his father's adventurous spirit, a combination that often led him to explore beyond the boundaries his parents set. The village was generally safe, with most residents keeping watchful eyes on all the children, but the forest was different. The forest held mysteries and dangers that even adults approached with caution, and on this foggy morning, when visibility dropped to mere feet and sounds became muffled and directionless, Jacob had wandered too far from home, while following what he thought was his cat, but turned out to be a trick of the mist and shadows. The fog had rolled in during the night, so thick that even longtime residents found themselves disoriented in familiar spaces. It was the kind of fog that transformed the world into an alien landscape, where trees became looming giants, and every sound seemed to come from everywhere and nowhere at once. Ethan had been preparing his equipment for a return to the observation posts when he heard the first shouts. Michael Bennett's voice cutting through the mist with a desperation that made everyone who heard it stop what they were doing. Jacob had been missing for 2 hours already, his absence discovered when Sarah went to wake him for breakfast and found his bed empty, the back door ajar, small footprints disappearing into the wall of white that had swallowed the world. The search party formed quickly but chaotically, the fog making coordination nearly impossible. Lily arrived at Ethan's cabin with a grim expression, explaining that the conditions were the worst she had seen in 5 years of living here. The mountain terrain was treacherous even in clear weather, with steep drops and hidden ravines that could injure or trap an adult, let alone a small child. The fog made it exponentially more dangerous, and with the temperature dropping and rain threatening, time was becoming a critical factor. Every minute that passed decreased the chances of finding Jacob safe, and the entire village knew it, though no one spoke the fear aloud in front of his parents. They divided into groups, each taking a different section of the forest, but the fog made their efforts feel futile. Voices calling Jacob's name were swallowed by the mist within yards, and the usual landmarks that might guide a search were invisible. Ethan found himself paired with Lily and 2 local men, Thomas and Robert, who knew the forest well but admitted they were essentially blind in these conditions. They moved slowly, carefully, calling out regularly and stopping to listen for any response, but the forest gave back only the muffled sounds of other search parties, equally lost in the white void that surrounded them. It was 3 hours into the search when Ethan heard it, a sound that made him stop so suddenly that Thomas walked into him. It was the clicking sound he had first heard months ago, the rhythmic pattern that had led him to his first observation of the bear. But this was different, more urgent, almost insistent. He looked at Lily, who had heard it too, her eyes wide with a mixture of hope and disbelief. Without discussing it, they began following the sound, the 2 local men following with confused expressions but trusting that anything was better than wandering blindly in the fog. The clicking led them deeper into the forest, away from the areas where the other search parties were concentrating their efforts. The terrain became more difficult, the ground sloping steeply upward, roots and rocks hidden by the fog until they were stumbling over them. Several times Ethan thought they had lost the sound, but then it would come again, slightly to the left or right, correcting their course like an audio beacon in the white darkness. He began to recognize a pattern in the clicks, almost like Morse code, though he couldn't decipher any meaning beyond the clear intention to guide them somewhere specific. They had been following the sound for nearly 30 minutes when the fog began to thin slightly, not clearing but becoming less oppressively thick. Through the wisps of mist, Ethan saw her, the bear, standing on a rocky outcrop about 50 yards ahead. She was massive even from that distance, her brown fur darkened by the moisture in the air, and she was looking directly at them with an intensity that made the 2 local men take involuntary steps backward. But Ethan recognized something in her posture, in the way she held herself, that wasn't threatening, but urgent, almost pleading. She made a low rumbling sound, different from anything he had heard from her before, and turned, moving into the fog with a deliberate slowness that suggested she expected them to follow. Thomas grabbed Ethan's arm, his voice tight with fear, as he warned that following a bear, especially one with cubs, was suicide. But Lily was already moving after the bear, and Ethan found himself explaining, as quickly and convincingly as he could, that this bear was different, that she was trying to help them. The explanation sounded insane even to his own ears, but something in his certainty, or perhaps the desperation of the situation, convinced the two men to follow, though they kept their hands on the hunting knives they carried and maintained a careful distance. The bear led them through terrain that would have been impossible to navigate in the fog without her guidance. She moved with absolute certainty, occasionally stopping to ensure they were still following, making that same rumbling sound when they fell too far behind. The path she chose avoided the worst of the hazards, skirting drop-offs and unstable ground that would have been invisible until too late. Ethan realized she wasn't just leading them randomly, but was taking them along a specific route she knew well, one that was safer than any path they might have chosen themselves. They had been following the bear for another 20 minutes when they heard it, a weak voice calling out, not for help, but for his mother, the universal cry of a frightened child. The bear increased her pace slightly, and within moments they found him. Jacob was huddled at the base of a large oak tree, his clothes torn and muddy, his face streaked with tears and dirt. His left leg was bent at an angle that made Ethan's stomach clench, clearly broken, and he had numerous cuts and bruises that suggested a fall from considerable height. The child's eyes were wide with shock and pain, but when he saw the adults, he began crying in earnest, the relief overwhelming his attempts at bravery. What happened next challenged even Ethan's expanded understanding of the bear's capabilities. She approached Jacob slowly, making soft sounds that Ethan recognized from her interactions with her own cubs, soothing vocalizations that seemed to calm the terrified child. Thomas and Robert moved to intervene, to put themselves between the bear and the boy, but something in the bear's demeanor, or perhaps the way Jacob actually reached toward her rather than away, made them hesitate. The bear lowered herself to the ground, making herself less imposing, and began examining Jacob's injuries with the same methodical approach Ethan had observed so many times before. She was particularly gentle with the child, her massive paws impossibly delicate as she checked his leg, felt along his ribs, examined a particularly nasty gash on his forehead. Jacob had stopped crying, staring at the bear with a mixture of wonder and instinctive trust that children sometimes show toward animals. The bear made a series of vocalizations to her cubs, who Ethan now noticed had been following at a distance, and one of them disappeared into the underbrush, returning moments later with a mouthful of specific plants that Ethan recognized from his months of observation. The bear began treating Jacob's wounds with the same precision she showed with forest animals, but with an extra gentleness that suggested she understood she was dealing with something special, something that required even more care than usual. She cleaned the head wound first, using moss soaked in water from a nearby stream, her touch so light that Jacob barely flinched. She then applied a poultice of crushed plants that Ethan knew had antiseptic and pain-relieving properties, securing it with strips of soft bark that she wrapped carefully around the child's head. The broken leg presented a more serious challenge. The bear examined it from multiple angles, her intelligence evident in the way she assessed the injury. She made a decision that demonstrated remarkable medical judgment, choosing not to attempt to set the bone, which could have caused more damage, but instead focusing on immobilization and pain management. She gathered straight branches, testing each for strength and flexibility, selecting only those that met her criteria. With movements that spoke of experience and practice, she created a splint that, while primitive, effectively immobilized the leg, while cushioning it with soft moss to prevent further injury. Throughout the treatment, the bear maintained a constant stream of soothing vocalizations, and remarkably, Jacob seemed to understand the intent, if not the meaning. He remained still when she needed him to, turned when she gently guided him, and even managed a weak smile when one of the cubs approached and nuzzled his hand. The two local men watched in stunned silence, their worldview reshaping itself with each passing moment. Thomas would later describe it as watching a miracle, something that made him reconsider everything he thought he knew about the natural world and humanity's place in it. The bear wasn't finished with just medical treatment. She seemed to understand that Jacob needed to be moved to safety, but that carrying him incorrectly could worsen his injuries. She did something then that Ethan would struggle to describe in his later reports, without sounding like he was writing fantasy rather than scientific observation. She began arranging branches and vines in a specific pattern, creating what could only be described as a primitive stretcher. She demonstrated to the humans how to hold it, positioning their hands with her paws, showing them how to lift without jostling the injured child. As they prepared to move Jacob, the bear did one more remarkable thing. She approached the child and placed something in his hand, a small, smooth stone with unusual markings that looked almost like symbols. Jacob clutched it tightly, and the bear made a sound that seemed approving before turning to lead them back through the fog. The return journey was faster despite carrying Jacob, the bear choosing a more direct route now that the urgency of finding the child had passed. She guided them unerringly through the mist, her cubs flanking the group like small guardians, occasionally making sounds that their mother would respond to with her own vocalizations. The fog began to lift as they descended toward the village, and they could hear the voices of other searchers growing closer. The bear stopped at a familiar landmark, a distinctive rock formation that Ethan recognized as being just minutes from the village edge. She turned to look at them, her eyes meeting each of theirs in turn, lingering longest on Jacob, who raised his hand weakly in what looked like a wave. Then she and her cubs melted back into the forest, disappearing into the mist as suddenly as they had appeared, leaving the 4 humans and 1 injured child to complete the final part of the journey alone. The reunion with Jacob's parents was emotional beyond description. Sarah Bennett collapsed to her knees beside her son, tears streaming down her face as she carefully avoided his injuries while holding him as close as she dared. Michael stood, frozen for a moment before joining them, his strong facade crumbling as relief overwhelmed him. The other searchers gathered around, everyone talking at once, trying to understand what had happened. Thomas and Robert attempted to explain, their words tumbling over each other as they described the impossible scene they had witnessed, the bear that had led them to Jacob and then treated his wounds with skill that defied explanation. Dr. Patricia Hawkins, the village's only medical professional, arrived within minutes and began examining Jacob with professional efficiency. Her expression grew increasingly bewildered as she cataloged his injuries and the treatment that had already been applied. The splint, while primitive, was perfectly positioned and had prevented what could have been catastrophic additional damage during transport. The wound care was exceptional, with no signs of contamination despite the forest setting, and the pain management was so effective that Jacob was remarkably calm for a child with such serious injuries. She kept asking who had provided the initial treatment, and the only answer anyone could give sounded like madness, that a bear had done it. Ethan found himself at the center of attention as the only person who could provide any kind of explanation for what had occurred. He chose his words carefully, explaining his months of observation, the medical knowledge the bear had demonstrated, the communication system she had developed with forest animals. Even with his scientific credentials and Lily's corroboration, many villagers struggled to accept what they were hearing. But Thomas and Robert's testimony was unshakable, and Jacob himself, despite his young age and trauma, insisted that the big bear had helped him, had made the hurt go away, had been nice like the doctors on TV, but better because she was a real bear. The stone the bear had given Jacob became a subject of intense curiosity. It was smooth, river-worn granite with natural veining that created patterns resembling symbols or possibly a map. Jacob refused to let anyone take it, holding it tightly even as he was prepared for transport to the regional hospital. He kept saying the bear had given it to him so he would be brave, that it was special and would help him get better. Whether it was the placebo effect or something more, Jacob's recovery would prove remarkably swift and complete, defying the typical prognosis for his injuries. The story spread through the village like wildfire, growing and changing with each telling. Some embraced it as proof of something magical in their forest. Others remained skeptical despite the evidence, and still others worried about what it might mean for their quiet community if word spread to the outside world. Ethan and Lily found themselves in the position of having to make quick decisions about how to manage the situation, how to protect the bear while acknowledging what had happened, how to balance scientific truth with the need for discretion. That evening, as Jacob was being airlifted to a larger hospital for surgery to properly set his leg, Ethan stood at the edge of the forest with Lily and several villagers who had gathered to process the day's events. The fog had completely lifted, revealing a sunset that painted the mountains in shades of gold and pink. Somewhere in that vast wilderness, a bear with medical knowledge was probably returning to her normal routine, checking on her regular patients, gathering medicinal plants, teaching her cubs the healing arts. But now she had done something even more remarkable. She had crossed the species barrier to save a human child, demonstrating that her compassion and medical knowledge extended beyond the forest community to include humans in need. The implications were staggering. If the bear could recognize a human child's need for help and provide appropriate medical care, what did that say about her cognitive abilities? How did she understand that humans were not a threat in this situation? That helping Jacob was not just possible but necessary? Had she been observing humans as much as Ethan had been observing her, learning about them, understanding their vulnerabilities and strengths? The questions multiplied with each passing hour, but one thing was certain. The relationship between the village and the forest had fundamentally changed. Over the following days, as news of Jacob's rescue spread and his condition improved remarkably in the hospital, Ethan noticed changes in how the villagers interacted with the forest. There was less fear, more respect, and a growing sense that they were part of something larger than just a human community. People began leaving small offerings at the forest edge, not food that might attract dangerous animals, but useful things like clean cloth, sharp stones, even some basic medical supplies. Whether the bear would ever find or use these offerings was unknown, but the gesture itself was significant, an acknowledgement of the bear's place as a healer who transcended species boundaries. The scientific community's response to Ethan's carefully worded preliminary report was predictably mixed. Some dismissed it outright as anthropomorphism, taken to an absurd extreme. Others were intrigued but skeptical, demanding more evidence, more documentation, more proof that this wasn't an elaborate hoax or misinterpretation. A few, particularly those who had spent their careers studying animal intelligence, were genuinely excited by the possibilities the discovery presented. Funding offers began arriving, some from legitimate research institutions, others from less reputable sources that saw commercial potential in the story. Ethan and Lily worked with the village council to establish protocols for protecting the bear and her habitat. They created a buffer zone around her territory where development would be prohibited, established guidelines for any researchers who might be permitted to study her in the future, and most importantly, kept the exact location secret from all but a trusted few. The bear had saved Jacob's life, and the village felt a collective responsibility to protect her in return. It was an informal conservation agreement, but one backed by the fierce loyalty of a community that had witnessed something extraordinary. Jacob's recovery became something of a medical curiosity in itself. His bones healed faster than expected, his wounds left minimal scarring, and his psychological recovery from the trauma was remarkably smooth. He drew pictures of the bear constantly, depicting her not as a fearsome predator but as a friend, a healer, a protector. His parents, initially traumatized by nearly losing their son, became unexpected advocates for wildlife conservation, understanding that the forest that had nearly claimed their child had also provided his salvation through its most unlikely inhabitant. The stone Jacob had been given became a talisman of sorts, never leaving his possession even months after the incident. He would hold it when he was scared or hurt, claiming it made him feel better, made him feel brave like the bear had told him to be. Geologists who examined photographs of it could identify it as local granite, but could offer no explanation for the unusual patterns in its veining, patterns that seemed too regular to be entirely natural, but showed no signs of artificial manipulation. It remained a mystery, like so much about the bear and her capabilities. As spring progressed into summer, Ethan continued his observations, now with more support and resources but also with more responsibility. The bear seemed aware that something had changed, showing more caution in her movements, keeping her cubs closer, being more selective about which animals she treated and when. But she continued her practice, continued teaching her cubs, continued maintaining the complex medical ecosystem she had created in the forest. The fact that she had saved Jacob proved that her compassion extended beyond her own kind, but it also showed that she understood the potential dangers humans represented and adjusted her behavior accordingly. The unspoken promise. The summer brought an unexpected heat wave to the mountains, the kind that old-timers said came only once in a generation, when the air itself seemed to shimmer with intensity, and even the ancient trees appeared to wilt under the relentless sun. It had been 3 months since Jacob's rescue, and the boy had made a complete recovery that his doctors called miraculous, though those who knew the truth understood that his initial treatment by the bear had been crucial to that outcome. The village had settled into a new normal, one where the existence of the medical bear was an open secret, discussed in hushed tones but fiercely protected from outsiders who might exploit or harm her. Ethan had established a more permanent research station with the help of a small grant from a progressive wildlife foundation that understood the need for discretion. He had been joined by Dr. Jessica Brooks, a cognitive ethologist whose work on animal intelligence had prepared her somewhat for what she would witness, though even she had been stunned into silence during her first observation of the bear's medical practice. Together, they had documented over 200 separate medical interventions, cataloging techniques, medicinal preparations, and outcomes with scientific rigor, while maintaining the respectful distance that the bear's welfare required. The heat wave had created new challenges for the forest ecosystem. Water sources were drying up, forcing animals to travel farther and compete more fiercely for resources. The stress was leading to more injuries, more conflicts, and more patients seeking the bear's help. She had adapted her practice to the conditions, setting up a temporary treatment area closer to the remaining water source, creating shade structures from branches and leaves, and even developing new treatments for heat-related ailments that Ethan had never seen before. Her ability to adapt, to innovate in response to changing conditions continued to astound the researchers. It was during this difficult period that the bear faced her greatest challenge yet. A forest fire had broken out on the far side of the mountain, still miles away, but driven by winds that could bring it closer within days. The smoke was already affecting air quality, and animals were beginning to flee the affected areas, many arriving at the bear's clearing with burns, smoke inhalation, and injuries sustained during their panicked escape. The bear worked tirelessly, treating dozens of patients each day, her cubs assisting with increasing skill as the crisis demanded all their collective abilities. Jacob had been asking to visit the forest again, to see the bear who had saved him, though his parents were understandably reluctant. The stone she had given him had become his most prized possession, and he spoke of her often, describing dreams where she taught him about the forest, about healing, about the connections between all living things. His parents had initially dismissed these as the fantasies of a child processing trauma, but the dreams were so detailed, so consistent, that even they began to wonder if something more was happening, some form of communication they didn't understand. The fire situation worsened over the next 2 days, and evacuation plans were being prepared for the village. But there was a problem that no one had anticipated: the bear and her cubs. They couldn't be warned in conventional ways, couldn't be evacuated like domestic animals, and their clearing was directly in the potential path of the fire if the wind shifted. Ethan and Jessica struggled with the ethical dilemma of whether to intervene, to try to warn the bear somehow, or to let nature take its course. But how could they stand by and let such a remarkable creature potentially perish, when she had saved a human child without hesitation? It was Lily who proposed a solution that seemed both impossible and inevitable. Jacob claimed the bear communicated with him through dreams, through the stone she had given him. Whether this was true or simply a child's imagination didn't matter if it might save the bear's life. With his parents' reluctant permission and under careful supervision, Jacob was brought to the forest edge as smoke began to thicken in the air. He held his stone tightly and spoke into the forest, his young voice carrying a message of warning, of danger coming, of the need to move to safety. What happened next would be debated and analyzed for years to come. The forest fell completely silent, even the ever-present bird calls stopping as if the entire ecosystem was listening. Then, from deep in the woods, came an answering call, the bear's distinctive vocalization, but different, more complex, almost like language. Jacob listened intently, his face scrunched in concentration, then turned to the adults with tears in his eyes. "She knows," he said simply. "She knows, and she's getting everyone ready to leave." He couldn't explain how he understood, only that he did, that the stone somehow let him feel what she was saying. The evacuation of the forest animals that followed was unlike anything in recorded wildlife behavior. It wasn't the chaotic flight typical of animals fleeing fire, but an organized withdrawal. The bear led the exodus, her cubs flanking her, followed by what seemed like every mobile creature in her territory. Predators and prey moved together without conflict, maintaining spacing but unified in purpose. Birds served as scouts, calling out information that the ground animals seemed to understand. The injured were helped by others of their species, and even some cross-species assistance was observed. A fox helping a limping rabbit, a deer allowing an injured badger to lean against it for support. The bear brought her medical supplies, her cubs carrying what they could in their mouths, other animals helping transport the carefully wrapped bundles of medicinal plants and tools. It was the evacuation that showed planning, cooperation, and foresight that challenged every assumption about animal behavior and intelligence. The procession passed within sight of the village, and dozens of residents witnessed it, many recording it on their phones despite Ethan's requests for discretion. The bear paused at the forest edge, looking directly at the gathered humans, her gaze finding Jacob in the crowd. What followed was a moment of interspecies communication that transcended scientific explanation. The bear approached slowly, cautiously, until she was just 20 feet from the crowd. Everyone held their breath, parents pulling children back despite the bear's non-threatening demeanor. She sat back on her haunches and made a series of vocalizations, complex patterns that seemed to carry meaning, even if the specific message was unclear. Then she did something unprecedented. she picked up a stick and began making.